Today we're going to be talking about heart disease and more specifically heart attacks. So our goal today is to be able to describe the cause and effect of heart disease. This could include heart attack. There are other ones we can talk about as well. Different teachers are covering slightly different ones, so we kind of have those in there as suggestions. So cause of heart disease and symptoms, and we're going to be narrowing in on heart attacks specifically. So if you take a look at this graph, you'll see that heart disease is the number one death or cause of death in the US, even more than cancer. So it's a super common thing that happens to a lot of people. There are a lot of different types of heart disease. You could have a disease that affects your valves. You can have your heart failing. You can have an infection. There's lots of different types of heart disease. Some of them you're born with, like, for example, if your valves don't work properly, or maybe you have a heartbeat that's a little bit different, like a heart murmur. And then some of them develop over time. And we're going to be focusing on the ones that develop over time. The most common one is coronary artery disease, which is when your heart, the arteries in your heart become blocked. And that's what leads to a heart attack. So here's what happens. Normally we have the blood pressure, the pressure of the blood pushing against the walls of our artery. If that's normal, everything works normally. If we have high blood pressure, what happens is it causes these little tears in our artery walls, and these little tears cause this plaque to build up. This plaque is made of like cholesterol and fats from our food that we eat in our diet. And over time, those little tears too can cause platelets to come, and the platelets kind of cause a scab and make it even more clogged up in here. And so eventually, sometimes this can narrow so much that our blood stops flowing in this part. When this happens I'm going to skip this. When this happens in our arteries in our heart, it is called a heart attack. So a heart attack is when part of the heart stops working because the coronary arteries are blocked. Now, the coronary arteries are ones we haven't talked about. Coronary arteries are the ones that supply the heart cells with blood. So we've talked about like the aorta and the inferior vena cava and superior vena cava. What's happening here is that the blood that supplies, there's little blood vessels that supply oxygen and nutrients to the cells, the muscle cells that make up the heart. Remember, we talked about how every single cell in our body needs oxygen and nutrients. So there has to be little capillaries and arteries that are bringing oxygen and nutrients to all the cells that make up the heart. If one of those gets blocked, here's what happens. The blood flow can't get to that part of the heart. It can't deliver the oxygen and nutrients. So what do you think is going to happen to those cells in the heart? Well, they're going to end up dying. If those cells in the heart die, or enough in a certain part of the heart start dying, our heart doesn't function as well. So remember, our heart is squeezing the blood, pumping the blood throughout our body. It's not going to be able to pump the blood as easily or as effectively. And it can cause a bunch of different symptoms. So when we look at risk factors here, we're going to talk what would put somebody at risk of having a heart attack. Well, it's a lot of the same ones that we've been talking about with pulse and blood pressure. So things like family history, so genetics. Your genetics can make you more likely to have high cholesterol or to have high blood pressure. If we take a look, age. So the older you are, the more likely your arteries have more tears in them, and you've got more buildup that's going to narrow them. Smoking. This increases your blood pressure, and then the chemicals in cigarette smoke also kind of harden your arteries and make them less elastic. And then, of course, diet and exercise. So if you're eating a lot of cholesterol-rich foods, you've got more cholesterol floating around in your bloodstream, which can then block up your arteries. So let's take a look at some of the symptoms. There are different symptoms for people who are born male at birth or female at birth, and we're going to write a few in our chart. So the three that we're going to pick are shortness of breath, chest pain or discomfort, and feeling lightheaded. So when someone's short of breath, why is this happening? Well, if you think about it, the heart's job is to beat. If the heart is not able to beat as well, or pump blood as well. We're not getting oxygen to every part of our body, and we're going to start to breathe faster to try to get more oxygen. If we have pain in our chest, well, what happens when your muscles don't get enough oxygen? Maybe you've been running really fast and your muscles don't get a lot of oxygen. They start burning. The same thing kind of happens, or maybe cramping. Well, that's what's happening in the heart or the chest. The muscle cells, our heart to muscle, is not getting enough oxygen and they start cramping. And then feeling lightheaded. So again, if we're not getting enough oxygen into our brain, we're gonna start to feel lightheaded. So you might be wondering, well, what can we do if somebody is having a heart attack, or what do they do once they go to the hospital? You don't need to write these treatments down, but just telling you in case you are interested. So they have to figure out how to get this artery unblocked. Sometimes they'll put a balloon in there and inflate it and make your artery bigger. That's called an angioplasty. You can see here's the blood vessel that's blocked, and then afterwards it's unblocked. Sometimes they put a piece of wire mesh in there, and that piece of wire mesh expands the artery. It's called a stent. Here's an example of one here, super skinny, and then they widened it. And then you can also have a bypass, and they take a new artery, usually from a cadaver, like a dead person, and they will just go around the block. So if the block is here, they'll just make like a new pathway. Remember we talked about arteries and veins being kind of like roads, so make a new road. So heart attack affects a lot of different people. It's the number one cause of death in the US, but there are things we can do to prevent and decrease our risk for heart attack.